Hey, what's going on, everybody? It's Dr. Matt from Pinnacle Chiropractic, your local pediatric and prenatal and family chiropractic office here in the Lakewood Ranch, Sarasota, Bradenton, Florida area. In today's video, we're going to talk all about dysautonomia, which is basically a fancy scientific term for dysfunction with the autonomic nervous system. So dysautonomia is a condition that's often widely overlooked. It's very misunderstood and it's poorly cared for in today's traditional medical model. But as parents, we all dream of a life where our kids are happy, they're healthy, and they're thriving. But for hundreds of thousands of families today, when this perplexing condition called dysautonomia sets in, their child begins to suffer daily from debilitating issues, things like mood disorders, gut problems, chronic pain, muscle weakness, and more. Dysautonomia is also a significant underlying factor in things like autism, ADHD, sensory processing disorder, seizures, POTS, PANS, PANDAS, and the list goes on, all of which are now seen at significantly higher rates than they were just a few years ago. So while traditional medicine can sometimes offer symptomatic relief, many parents often wonder if there's something more that can be done to help to get to the root cause of this issue and help their child achieve full recovery and optimal outcomes from dysautonomia and all of its related health challenges. So in this video, we're going to explain all about dysautonomia, what causes it to develop, what associated symptoms and health challenges come with it, why it's often overlooked, and how neurologically focused chiropractic care may be that missing link to restoring your child's nervous system balance through cutting-edge techniques and clinical protocols. So we'll start with a story of a child in our office that had and has dysautonomia. So for 17-year-old Francesca, health struggles ruled her childhood. She was plagued by seizures since the age of 7, and then it started with worsening fatigue, anxiety, and eating disorder and constipation through puberty is really when her quality of life really started to suffer. So despite constant medical care, doctors had no explanation for why she experienced such a multitude of symptoms altogether. It often felt like they were simply treating random issues in isolation versus getting to one real root cause. That was until Francesca's mom learned about dysautonomia from a friend and one trip to a specialized chiropractor that changed everything. So this next part will really dive into the science behind dysautonomia. So dysautonomia, it's really a breakdown affecting the autonomic nervous system. It's that master control center that manages nearly every organ and system in the body, from things like digestion and regulation of inflammation to breathing and blood pressure regulation. So when that autonomic nervous system is not functioning properly, dysautonomia throws off the communication between the brain and the body, which then manifests itself in diverse symptoms that differ based on which organs are impacted. So the most common symptoms that we see affected are things like gut issues, anxiety, heart palpitations, and fatigue. And they are related to the most commonly affected systems, which are the digestive system, cardiorespiratory system, and the brain. So what really triggers or leads to or causes dysautonomia in the first place? Well, not only do traditional medical doctors and neurologists struggle to properly recognize and effectively treat dysautonomia, they also struggle to explain what's really causing it. So our clinical observations and research review highlight the 5 main triggers of dysautonomia. The first one is prenatal or maternal distress or stress, such as a high risk or high anxiety pregnancy that exposes the developing fetal nervous system to excessive stress hormones in utero and may lead to an underdeveloped vagus nerve and parasympathetic nervous system. The second thing is birth intervention. So things like forceps, vacuum extractions, and C-sections, these lead to physical injury and trauma that lead to biomechanical misalignments and subluxation in the upper neck and mid-back areas, which then negatively impact the function of the vagus nerve and parasympathetic nervous system once again. So vagus nerve injury, damage, and dysfunction are without a doubt the leading cause of dysautonomia. The third thing is altered development and missed milestones. So these may leave the brain and nervous system underdeveloped, off track, and less resilient and adaptable later in life. The fourth thing being recurrent infections, ongoing gut issues, and chronic inflammation, and the overuse of antibiotics and other medications throughout a child's life. And then the fifth one is chronic sensory challenges and anxiety in kids. These trigger a continual stress response of excessive stress hormones. So the vicious cycle of dysautonomia is really this over time, this cascades into a vicious cycle where the overdriven nervous system fails to regulate itself properly, which is once again called dysautonomia. Once dysautonomia really sets in, the patient struggles to properly maintain homeostasis, regulate their nervous system, and to adapt to even regular daily stressors and routine. But the positive thing is there is hope. Tracking dysautonomia through neurological insight scanning technology. So while traditional medicine continues to lag behind in their understanding and proper care for dysautonomia, there's an entire network of specialists called neurologically focused chiropractors who have a deep understanding of dysautonomia and can provide a drug-free clinical approach that addresses the root cause head-on, which this unique and cutting-edge approach begins first with a deep dive into the patient's case history to find if any of those 5 things that we talked about, the perfect storm risk factors for dysautonomia, occurred. From there, we can get to the really exciting part, which is our nervous system scans, the Insight neurological scans and heart rate variability technology. These scans can find and detect the presence of neurological dysfunction and dysautonomia at an incredibly advanced and in-depth level, going far beyond what medical testing like blood work, MRIs, or even EEG may reveal. The most important element of these incredible scans is the HRV exam, which is gold standard for finding dysautonomia and then being able to track and measure positive improvements in the autonomic nervous system function as the adjustments begin and care progresses. The doctors that we're a part of in the PX Docs network are trained specifically in caring for dysautonomia without drugs, and they know how to use specialized techniques and clinical protocols that seek to restore balance to the autonomic nervous system, activate the vagus nerve, and over time help the patient regain an incredible quality of life. So if you want to learn more about dysautonomia and how neurologically focused chiropractic care can be the missing key to drug-free relief and neurological restoration, please comment below, send us a DM, or see the link in our bio for more information. So hope you guys enjoyed this video all about dysautonomia. If it sounds like your child, reach out. We'd love to help them. As always, guys, I'm Dr. Matt.